Enuresis and incontinence with liver fire infusing downwards as a pattern. Clinical manifestations: nocturnal enuresis in children, grinding teeth at night, restless sleep, nightmares, waking up crying, thirst, bitter taste, hypochondrial pain. Tongue is red with redder sides, yellow coating. Pulse, wiry and rapid. Enuresis in children can be classified in two broad categories. On the one hand, quiet and shy children. On the other, rather hyperactive and nervous children. The pattern of kidney deficiency pertains to the former group, while that of liver fire pertains to the latter group. Nocturnal enuresis in such children is also due to agitation of the ethereal soul or kun at night by liver fire. Treatment principles: soothe the liver, drain fire, calm the mind, and settle the ethereal soul. Points: liver 2, heart 7, in tank, spleen 6, bladder 28. Reducing method on all points except bladder 28, which should be reinforced. Liver 2 drains liver fire. Heart 7 and in tank calm the mind. Spleen 6 regulates the water passages and calms the mind. Bladder 28 strengthens the bladder function. Case history. An 11-year-old boy had been suffering from nocturnal enuresis from birth. He never had a dry night. He appeared to be a very tense child with a nervous tick over his eyes. His tongue was red with redder sides and tip and red points on the sides and tip and a yellow coating. His pulse was full and wiry. This boy's condition is very clearly liver fire. This is very often seen in tense and nervous children. The principle adopted was to drain liver fire, absorb leakages, calm the mind, and settle the ethereal soul. He was treated with acupuncture and two patent remedies. The acupuncture points used with reducing method were selected from the following: liver 2 to drain liver fire and settle the ethereal soul, heart 7 to calm the mind, spleen 6 to pacify the liver. Case history. Another case history is of a 10-year-old girl had been suffering from nocturnal enuresis since birth. She did not wet the bed every day like the boy in the previous case history, but about twice a week. When she was 5, she had had a bout of cystitis with burning on urination. She was a shy and quiet child with a pale complexion and a bluish tinge on her forehead. Her tongue was pale but with red points along the left side and on the root. Her pulse was very slightly wiry on the left side and otherwise normal. This child manifests symptoms from both full and empty types of patterns causing enuresis. There is a kidney deficiency manifesting with a pale tongue. This deficiency was probably due to fright, which may even have occurred in utero, as the bluish tinge on her forehead shows. Besides this, there is some liver fire and damp heat in the bladder, manifesting with the red points along the left side and on the root and the wiry pulse on the left. The cystitis episode she had when she was 5 would seem to confirm this. The principle adopted was to tonify the kidneys, absorb leakages, calm the mind, settle the ethereal soul, and pacify the liver. She was treated with acupuncture and patent remedies. The acupuncture points used with even method to pacify the liver and reinforcing method to tonify the kidneys were selected from the following: heart 7 to calm the mind, liver 2 to clear liver fire and settle the ethereal soul, spleen 6, kidney 3, ren 4, and bladder 23 to tonify the kidneys. Thank you very much for your attention.